Hello everyone, this is Dr. Piyali Ghosh welcoming you all to Narayana Superspeciality Hospital. Today is an auspicious day for us. We have finished 100 robotic cases in our unit. So on today's occasion, let's meet two of our robotic surgeons, Dr. Tarun Jindal, Uro-Oncologist and robotic surgeon, and Dr. Kaustav Basu, Gynae oncologist and robotic surgeon. So, sir, congratulations, sir. So, first question for Dr. Jindal. Sir, why is this number 100 so important? Why is this a landmark?
See, there has to be a landmark to celebrate the efforts which we are putting into robotic surgery. As the cricketers have a landmark of celebrating 100, as in movies you celebrate 100. So this is the reason why we have, this is just a landmark to ceremoniously put in that we have been able to be successful in our journey of robotic surgery.
And sir, how much time did it take for us to reach 100, this magic figure?
The robot got installed in the year 2021, February. So it's been just over a year that we were able to finish off 100 cases.
So next case is for both of you. What are the major kind of surgeries which you have done in this 1 year, almost a year? And were there any rare cases which you did?
Right. So in my specialty there is Gynae oncology. We conventionally do a robotic surgery in endometrial cancer and cervical cancer. So we have done quite a lot of endometrial cancer cases, and especially we can use this platform for doing a unique technique which is called sentinel lymph node dissection, which is not possible in the laparoscopic platform, so which we have done. And otherwise we have done a lot of benign cases as well, especially the pelvic endometriosis, which is technically very difficult to operate in a open platform or in a laparoscopic platform, but with the help of robotic platform, endometriosis surgery has become very easy for us. So we have done quite a lot of them as well. So Dr. Jindal?
So in my field, their majority, it's basically a mixed bag of prostate cancers, bladder cancers, kidney cancers, in which we do radical nephrectomies, that is the removal of the entire kidney, or a partial nephrectomy in which we just remove the tumor containing part of the kidney. The special surgeries which we have been able to do in this particular time frame is a very unique surgery called retroperitoneal lymph node dissection, which we do in patients of testicular cancer who have residual retroperitoneal masses after chemotherapy. Along with that, a very rare surgery which was done was the groin dissection by the help of a robotic platform, and couple of very interesting and very challenging surgeries, like there was a patient who had a radical cystectomy done by open approach, and he had a recurrence of tumor, so we were able to treat that robotically.
And even in some cases we did a joint surgery as well.
Correct.
So for a fibroid uterus and a partial nephrectomy, so it was very useful.
Sir, how much time does it take for a surgeon to become a robotic surgeon?
Right, I think Dr. Jindal would be very helpful.
So there is a very fixed curriculum. So if we are considering Da Vinci sets up a very fixed curriculum that first of all you have to spend at least around 80 hours on the dry labs, simulations, and just to get accustomed to the robotic platform. After that, Da Vinci has a wet training lab in which you are taken to an institution which is basically doing robotic surgeries in good numbers, and you are made to observe those things, and then in the lab you get to operate upon porcine models. And whatever your field is, I'm a urologist, so I was basically taught about how to do a robotic nephrectomy or how to do a robotic prostatectomy. So after that, then they ask, once you start doing surgeries, then they send mentors, so they are there for at least say 5 to 7 cases, unless you become absolutely comfortable in the robotic platform, and they basically are there to help you out in the cases if you get stuck up in the initial part of the learning curve. Then about learning curve, I would say for any specific oncological or non-oncological case confined to one particular organ, I would say around 25 cases are required to overcome that particular thing.
And sir, this question is also for both of you. So in your particular subset of patients, do you think the acceptance of robotic surgery has increased?
Right.
And
So
what I mean, what is the criteria people look for? What do they question
Right.
you about?
So initially when we started the program and we were creating a lot of awareness programs, so that time we had to counsel the patients what were the advantages of robotic surgery, why are we promoting this surgery, why are we asking the patients to opt for this platform. So that was there from our part, counseling and patients acceptance. Now after 50 cases, what we find that patients are coming to us asking for robotic surgery. They are well aware of the consequences, the advantages, and they are asking for, sir, are you doing robotic surgery? So that's the change we are seeing last 50 cases.
Agreed. I mean, now the awareness has definitely increased, and the common things which we see in our OPDs is that people do come that they have been offered open surgery in a different center, and they come because they know that robot is feasible. I mean, robot is useful. So they come to us to have opinions whether this particular disease of yours can be treated by robotic surgery or not. And majority of the times we have been able to successfully treat those patients by this approach.
Okay, sir. Now, in your experience, does robotic always ensure good results?
Right. So as of now, what we have seen with our experience, because of the extreme freedom of movement of the robotic arms, as you were seeing all the robotic arms are docked here. So because of this freedom of movement, and we have a special unit called the endorist in the robotic instrument, that increases the freedom much more. So with that freedom, we can operate these patients very easily and very meticulously. Blood loss is much less. We have all spoken about the advantages in our previous discussions as well. And pain control, the analgesia is very good, post-operative pain management. So with all this, we have seen that the outcome, we call it the functional outcome, post-operative outcome, the day when the patient goes back home and he can start his or her routine activity is much less, is much faster. So that's the biggest advantage, especially when in an oncological setting, surgery is not only the answer. We have to give the adjuvant therapies like radiotherapy and chemotherapy. So once the patient is fit very earlier, so we can offer those adjuvant therapy which are equally important in a cancerous treatment much faster. So that's the biggest advantage. So for per se oncological outcome does not improve with the robotic platform. It is equal for open laparoscopy as well as the robotic platform, but the adjuvant therapy and the functional outcome is much improved.
Sir, what will you say about the paraphernalia of starting a robotic center?
Right, a very interesting question. So I would say just getting a robot is not sufficient. So any hospital which is thinking about starting a robotic platform has to identify certain important factors. So there has to be a definite space where the robot needs to be kept. Apart from just the logistics of having a robot, you need to have a dedicated team available. So this team is inclusive of the anesthetists who are absolutely trained into giving robotic anesthesia, because the type of anesthesia which is required, the positioning which is required is very different than the conventional surgeries. You need to have good OT technicians who are available there to manage the robotic instrumentation. You need to have nursing staff which is absolutely well trained and identifies the parts of the robot, instrumentations which is required, and whatever supplementary material which is required during surgery. You also need to have a very good assistant who is basically the main important person at the bedside, because the surgeon operates at a distance. So he is the first person who's there to control everything around the robot. And then obviously you require people, the surgeons who are experienced in this platform and are able to give you good results. So this is the entire setup which is required to start a successful robotics program in any hospital.
Thank you, sir. So to sum it all, do you have anything for our viewers, sir?
Right. So as I told you, with the 100 cases we are reached, what we have observed that this is a very safe platform to operate. We all, patients and their relatives, must be very anxious whether it's a technological development, it's a robot which is linked to the name. So actually it is not, because the surgeon is operating with the help of, so it's a robotic assisted surgery. But they have to understand that because the system is made that way so that it becomes very safe to the patient. So at any point of time, any error which occurs within the performance, that will be notified in the surgeon's console as well as in the display above. So it's very safe, and we can understand that difficult cancer surgeries which is not possible laparoscopically is always have to be an open surgery, can be operated. That's challenging cases can be operated using this platform, and the patient can go home very early.
The other important thing is the awareness. I mean, people are aware of robot, but the hitch is that they are always skeptical that the machine is operating upon them. So it's not the machine it is via a particular machine. The entire system is under control of a surgeon. The advantages of robotics are, I mean, people very well know about the advantages, but this misconcept of that a system, automated system is operating upon you is ill-founded. The surgeon is very well under control of everything. He is the one who is actually performing surgery, and he is the one who controls these entire processing of surgery.
Thank you, sir. Congratulations again.
Thank you so much.
Thank you.